let's pretend the pregnancy nurse gets pregnant again. Beyond being wildly old, what would I do different the next time? Today, after watching thousands of births, having 3 babies of my own, plus talking to millions of pregnant individuals, today I really want to share what I would have done differently. And I think these are going to be really helpful. I want you to have a better birth than I did. That is literally my entire platform. A better, safer, more informed birth. So let's jump into it. And just by way of history, I am looking the big 50 in the face. My oldest is 25 years old. I have a middle that's 22 years old, and then my youngest is 16. So it's been a while since I had a baby, and my baby years are behind me, but I'm looking at my kids possibly having babies soon, and I really have some things that I want to share about what I wish I had done differently and what I would do the next time, besides need to be on a psych unit, because if I got pregnant now, oh, my pelvis. Goodbye. Goodbye, pelvis. The first thing I would have done is to put less pressure on myself. I had so much pressure to keep my house clean, keep all these things going, keep all the activities for the kids, put myself into labor. I had so much pressure on myself that I could control and do all of these different things. Now, I'm not saying that I would have lived in a sty. I'm saying that I wish I would have had my husband kick up a notch. Just told him that I was sort of done cleaning and it was his job. But I also wouldn't have just laid on the couch as a lump. I think movement is very important, but the pressure to keep up the life that you had prior to pregnancy can just be too much. Do what you want to do what makes you happy, do what you can do, but don't put so much pressure on yourself. I had way too much pressure on myself. If that's you and you relate to this, tell us down in the comments. This especially came in postpartum, so keep watching for proper postpartum expectations as well. Okay, the next thing I would have done is to live in a state that had maternity leave. Currently, I live in Arizona. There is no state maternity leave. Boo. But I had my last 2 babies in California, where I did get state maternity leave. But my first baby was in Utah, no state maternity leave. I barely, because we accrued sick time so low, I barely had enough sick time to cover my insurance costs while I was out on maternity leave. I got no pay at all. So, there's only so much you can do. But I wish every state offered maternity leave. I wish the entire United States offered maternity leave. But if I was young and thinking about where I wanted to live, I would angle to a state that offered it or a job that offered it. Nursing, less likely. You probably need the state benefits. By the way, nurses and teachers, which my husband is a teacher, have probably the worst maternity leave benefits of anyone. People who are constantly taking care of children and people in need have the worst benefits. What is up with that? I know what's up with that, but it's fine. It's fine. No. Just move to a good state. Okay, the next one is I wish, especially on my first, that I had taken an out-of-hospital birthing class. My birthing class was completely useless. I think they made me a good patient. They told me what my doctor was going to do, but they didn't talk about how I could make choices. They didn't talk about realistic expectations for even the hospital or definitely not postpartum. It was just useless. Now, this isn't true for all hospital classes. I used to teach for my hospital, but my manager let me completely rearrange the curriculum, and I pretty much had free reign to teach whatever the heck I wanted because they were just glad that I was there teaching. But a lot of hospitals tend to make you a good patient rather than really helping you prepare for birth. So there is a birth class that I recommend. I'm going to link it down below. The next one is kick counts. Now, if you've been with a pregnancy nurse for a while, you know that kick counts is a total soapbox of mine, and I did do them on my last baby. It wasn't a thing on the other 2 kids. The correct way wasn't a thing. And so I just wish that I had taken them more seriously. I did do them. When I was on shift, it's really hard to do kick counts as a nurse, but I would try to just count on my fingers while I was charting or while I was eating my dinner. I just wish I had done a little bit better at them. When you read the statistics that it can save 1 in 3 stillbirths, it really encourages you to do them really well. And I didn't know those statistics at the time. I had my last baby with Kaiser, and they gave me a little laminated book, and she went over them at every visit, and I was horrible at them, but I just wish I had taken it more seriously. And I gotta say, I also wish I had taken SIDS precautions more seriously. I had bumpers with my first baby, and I just carried them through with the rest of them, thinking the first one was fine. Hello, survivor bias. And I think safety is just kind of that way. You're always, in retrospect, you wish you had done some safety issues better, By the way, if you want a video on what I wish I had done better with my baby or after baby was born, I'd love to make that too. Tell me down in the comments. And by the way, if you're like, correct way to do kick counts, I'd love to share the correct way with the evidence as well. I have a cheat sheet that you guys can grab down below. I'll link it there. The next one is that I wish I had used a midwife. Now, first off, I love Call the Midwife, but it's not just about that. Midwives have decreased interventions overall. They spend more time at appointments educating you. They just have more time to be able to do that. They're in the room with you pushing. They're just spending more time with you. And I think the midwife model of care is the very best, where you start with a midwife as long as you're low risk, and then maybe you need to upgrade to an OB or a perinatologist or maternal fetal medicine specialist if things start to go awry. In fact, I had a gal on my podcast. She's a midwife and she has OBs and maternal fetal medicine in her practice. And those people can just consult. So if she sees something awry, the OB can come in, address that particular part of her pregnancy, and then she can continue to take care of the rest of her pregnancy. I have her podcast. I'm going to link it down below if you're looking for more benefits of midwives. But guys, I wish I had chosen a midwife. There weren't any offered at the hospital that I went to. I worked with midwives at the time, but I just think the midwife model of care is the best. Now, you are looking for a certified nurse midwife because Hillary, the pregnancy nurse, still wants to deliver in a hospital, and certified nurse midwives can do just that. It's really confusing because there's all different kinds of midwives. There's lay midwives, certified or licensed midwives. I don't know. There's like so many. So you're looking for a certified nurse midwife, which is abbreviated CNM. The next one is that I wish I had just gotten induced. Now, a little backstory. Hillary was 12 days overdue, and I was having prodromal labor that I thought I was going to labor every night for about 5 hours. My cervix was already 5 centimeters. It wasn't going any more than that, and I was just miserable. But I, of course, thought I had control and I could put myself into labor because I didn't want to be induced. I want it to happen naturally. And it just didn't. By 12 days overdue, I had already had a 9-pound baby on my last one. I'd had a 4th degree tear with my first one. I had what they call glucose intolerance. Like, there were all these things that my doctor just sat down and really had a heart-to-heart discussion with me. And I was like, yes, it makes sense that I get induced, but I don't know why I didn't get induced before then. Or knowing what I know now after seeing the ARRIVE trial, honestly, if you're past 39 weeks, that cervix is ripe and ready. You're in that same situation where you just want to have your baby and you're trying all these stupid different things. By the way, want to know if jumping jacks will put you into labor? I have a whole video on that one. I wish I had just gotten induced. That's the proven way to get your baby out. If you're trying things at home, it's really the same thing as trying it in the hospital. She had offered it a couple of times. I had declined it. The next one is perineal massage. So I have a whole video where I talk about preventing tearing. If you want a whole video about perineal massage, tell me down in the comments. This is actually part of a whole post on this, and my post on perineal massage is within that post. But perineal massage has been shown to decrease your chances of a 3rd or 4th degree tear, which I did tear on my first. Now, I had forceps, and he did an episiotomy before he did forceps. So would that have prevented that tear? I don't know, but I think it would have been worth my time. Now, caveat, I was not a labor and delivery nurse at the time, and I do think that perineal massage would have sort of given me the ick at the time. Doesn't give the ick now, but, you know, kind of get over that speed bump, and I think it can be really helpful. Again, if you'd like a full video on perineal massage, tell me in the comments. I'd love to make that for you guys if there's interest. Next, I wish I had gone through a birth plan with my partner. Honestly, I was so stuck in my head on that last baby where I just could not go into labor. I think if I had let him have the discussion with me, which of course Hillary was an island in the world, he may have been like, why are we doing this? You can just get induced, right? I needed another input, but I wasn't really open to it. And I think maybe talking through a birth plan ahead of time maybe would have opened up those gates. I think going through a birth plan with your partner just gives someone to bounce ideas off, someone that definitely has skin in the game. I have a whole birth plan mini series that's totally free. I'm going to link it down below. But it just kind of helps you guys go over those basic birth plan things to think about what you would like for your birth and then kind of open up those conversations, you know, as you get closer to delivery day. And speaking of partners, I wish I would have prepared with my partner better. Because I'm the pregnancy nurse, my partner was sort of left out of the preparation bit, right? Like I knew what was going to happen. He was like, great, I'll be in the corner grading papers because he was a teacher. And I wish I had involved him more. I wish he had better ideas about how to support me during early labor and during birth and postpartum. postpartum. I think that would have been extremely helpful. In fact, I have a birth class that I recommend that prepares partners to do just that. Again, I'm going to link it down below. But preparing with your partner, game changer. So many people just prepare themselves and end up with a partner in the corner, scrolling the TikToks or grading papers. Not helpful. The next thing I would have done is to check my prenatal vitamins better. I delivered with Kaiser. Kaiser just had a prenatal vitamin that was on the shelf in the pharmacy. I grabbed that. But there are so many prenatal vitamins out there, or at least vitamins like said prenatal on the label, that first off, don't even have all the requirements that they recommend for prenatal vitamins, including choline. I'm seeing a lot on choline, fish oil lately, but also aren't even third-party tested. So we don't even know if they have like the folic acid that we're supposed to have or things like that. So I wish I would have taken prenatal vitamins a little bit more seriously. I will actually link the prenatal vitamin resource that I trust right now. It's done by a dietitian who I think is absolutely amazing. I'm going to put it down below because it's really confusing. In fact, some of these prenatal vitamins are really no different than just like a regular vitamin. It's really disturbing when you look into it. And at the very least, talk with your provider, see which brands they're recommending that are readily available in your area. Back to Hillary in that labor room. I wish I had let them break my water earlier. So Hillary was 12 days overdue. My cervix was already 5. I was adamant I didn't want an induction, and I knew that as soon as they broke my water, I was stuck at the hospital. I could not go home. It was either have a baby through the birth canal or C-section. So I resisted letting them break my water for the longest time. But as soon as they broke my water, within an hour, I ended up having that baby. Literally, I think that was the only thing that was keeping that baby in there. I just needed that bag of water broken. And I don't know if my body ever would have done it naturally. So ultimately, Hillary needed to let go of control. And this is a life lesson for Hillary. If you're somebody who likes to control a lot of different things, my doctor offered several times to break my water. And I was like, no. And they were like, Hillary, I really think it will speed it along. Because my induction was kind of like putzing along. Like I got to 6 and then we were all just like, yeah, I'm contracting. I needed my water broken. Why didn't I listen to them? Now, this is very different than if you are like 2 centimeters, your provider breaking your water. Studies have shown that if they break it later on in labor, especially when, contractions really aren't doing anything, it can help labor progress. Very different than like having it broken when you're like 1 centimeter or something. So just something to think about. Again, in the post about this, I link the post about if you should let your provider break your water, because there are a lot of things to think about before you let them. And yes, you should always have consent ahead of time. My providers asked me if I wanted it, and I said no, and I wish I hadn't, but life lessons, right? Next up, I wish I prepared for postpartum better. And that's definitely on my first baby, completely unprepared for that. I have a whole video on it. I'm going to link it down below. But there were so many ways that I just wasn't prepared on every baby for postpartum and the reality that it would be. On my second baby, we bought a house and moved like 10 days after he was born. And I remember being on the phone with my mom when we had gotten our offer accepted and it looked like it was all going through. And she was like, Hillary, you're not going to be able to move boxes 10 days postpartum. And I was like, what are you talking about? Of course I will be able to. And she was like, you will have just had a baby. You're going to bleed a lot. I was a labor and delivery nurse at the time. I think in my head, I was just, Hillary is just going to power through this thing. It's going to be completely fine. I made the choice to not lift all those boxes. And my husband, because he was a teacher, his students actually came to our house and moved us. So I get let go of the control. A lot of things got put in weird places, but it ended up working out. And, that was important. I wish I'd prepared for postpartum better, at least just thought about what life would be like after I had a baby. In fact, a lot of times buying pads was like the very last thing on my list. Like, Hillary, maybe put yourself like at least in the mix with the baby. Prepare for postpartum. By the way, I have a whole video on your postpartum plan. I'm going to link it down below as well. And finally, I wish I had been kinder to myself, and I wish I had given myself more grace. It kind of goes along with the first one, but I wanted to bring it back full circle. I just put too much pressure on myself. Like, I remember thinking, Hillary, you had that baby 5 days ago. You got to get it together and haul those kids to school, right? My husband always had to go back to work very quickly after we had a baby. And I was like, you got to get this together. I also suffered with a lot of postpartum anxiety. And back in the day, they really only talked to us about postpartum depression. And I knew it wasn't depression because I knew I was having panic attacks every day. But I was like, I don't think there's anything that can really help with this. I just need to muscle through. I wish I had gotten medication. I wish I had prepared for postpartum. And I wish I would have let my village help out a little bit more. I had people willing to help me with my kids. And I was like, oh no, I got it. I didn't have it. I didn't need to have it. Those people would have been very glad to help me. I am one of those people who loves to help people postpartum. So let people help you. And on the reverse, a few months out after you have your baby, be that village. Offer to help people out. Offer to come to their house and help fold laundry. Offer to bring in a meal. If they have other kids, offer to wash the kids. You can really be somebody else's grace, and it can make a really big deal, but we have to be doing it for each other so that we can get it ourselves as well. So those are the things that I wish I had done differently, or I would do differently next time. There's not going to be a next time, ladies and gentlemen. I don't even want to think about a next time. So those are some mistakes that I made. I have a whole video on mistakes that people make going into their delivery that I think you guys are going to find super helpful. I'm going to link it up above. What did I miss? Are there other things that you would do differently on your delivery? Tell me down in the comments. Thanks for joining us here on The Pregnancy Nurse, where we get you prepared, not scared, for your upcoming hospital birth.